ascites. It is accumulation of abnormal fluid in the peritoneal cavity. Peritoneum consists of two layers, visceral layer and the parietal layer. The space in between two layers is called as peritoneal cavity. The amount of fluid, if it is up to 150 ml, it is graded as grade 1 ascites. Grade 2 ascites, the fluid reaches up to 1 liter. Grade 3, when it exceeds above the 2 liters accumulation of the ascitic fluid. The fluid consists of two types, transudate and exudate. In transudate, the amount of the protein is less than 2.5 gram per deciliter, while in the exudate, the amount of protein is above 2.5 gram per deciliter. The pathogenesis is in transudate formation. There is increase in the hydrostatic pressure in the portal veins due to portal hypertension. The fluid passes through diffusion in the interstitial tissues where the albumin remains inside the cells. Whereas in exudate, as that is infective one, due to acute or chronic infection, the endothelium of the vessels, they are damaged. So the fluid along with albumin, RBC, WBC, along with other pathogens, that gushes out into the interstitial space. So these are the difference in the pathogenesis of two types of ascitic fluids. Now, the etiology of the ascites. The transudate formation is about 80% from the cirrhosis of the liver, due to which there occurs portal hypertension, and that causes the diffusion of the fluid into the interstitial tissue, in addition to cirrhosis of the liver, which is caused by prolonged overuse of the alcohol, smoking, that is a chronic infection of the liver, that is the hepatitis C, hepatitis B, and the other carcinogenic changes of the liver. In addition to heart failure, constrictive pericarditis, Budd-Chiari syndrome, these are the various factors that causes the transudative ascites. While the exudative ascites is produced by the infection, whether it is acute or chronic, that is tuberculosis, that is spontaneous bacterial peritonitis, cancer formation, peritonitis, pancreatitis. These are the various factors that causes the exudative ascites. So in this case, there is leakage of the protein in the interstitial tissues along with pathogens and the cancer cells and the tuberculosis and the other pathogenic organisms responsible for the damage of the vessels. So these are the difference between the exudative and the transudative ascitic fluid. So these are the various causes that produces the accumulation of the abnormal fluid in the abdominal cavity, that is in the peritoneal cavity.